Hey guys, Dr. Ben here. Excited to talk to you today about autoimmunity. Autoimmunity is rampant, it's everywhere. We see it every single day in practice. The research is going crazy with autoimmune. We've got a very high percentage, 20, even 30% of the population, some of the reports are showing that we have autoimmunity. Autoimmunity is not something that should be happening. We should not be attacking our own tissue. I'm going to get into what autoimmunity is, what are 3 of the main causes of autoimmunity, and then things you can do today to get going on this. So think about this. Autoimmunity, there's over 190 named autoimmune conditions. It is the 3rd leading cause of death when you put them all together. And we're going to get into why you should put them all together when we're thinking about autoimmunity. So if anybody is jumping on, if you've got autoimmune, you know somebody with autoimmune, put it down below. Let us know what you guys are dealing with. There's going to be things probably that I may never even have heard of. You know, out of these 190 named autoimmune conditions, there's some obscure ones that people are getting that we've never even heard of. Hey Mary, good to see you. So pop those down below if you or a loved one is dealing with autoimmunity. It's rampant, it's everywhere, and why would the body go haywire? So let's get into this. So what is autoimmunity? Autoimmunity is, think about this. So you've heard of this virus going around. Anybody know a virus that you may have heard of? So you've got a virus. The body makes antibodies. So you've heard of the COVID antibody test. The antibodies are going to go and tag that virus, and then the immune system comes in and destroys it. So the antibodies are going to be the Navy SEAL with the little laser pointer gun, and it puts that laser on the little house, and then the drone comes in and blows that up. That's what antibodies do. So normally antibodies get revved up and they trigger and stimulate. There's some Hashimoto's. Yep, that's a very common one, probably a top 5. So that antibody tags the bad thing for destruction, and then the immune system comes in and destroys it. But here's the problem, is that in just the average person that's not dealing with any type of an infection or whatever else, it's not only going to be attacking those bad things, but it starts attacking our own tissue. So that antibody is going to tag the thyroid for destruction, or the bus that transports thyroid tissue around. And that's what's called Hashimoto's. For my mom that used to have MS and now she doesn't, thank you, there's no more MS in her body, she got rid of her wheelchair and everything, her nerves were being tagged by antibodies, and then that immune system was coming in and attacking it. For somebody that has Crohn's disease, it's attacking in the digestive tract. For somebody that's got rheumatoid arthritis, it's in the joints there. For somebody that's got alopecia, losing their hair, that's autoimmune there. Or vitiligo, where you see people and their pigment is being attacked. For my wife that had autoimmune to her platelets, they ended up taking out her spleen. We have seen so many different types of autoimmune conditions. So if you're dealing with autoimmune, or a loved one is dealing with autoimmune, you've got to get to the underlying why. And this is such a crucial topic, and really the kingpin of anybody getting over autoimmune conditions is to be able to go through and fix the why. Because in the traditional medical model, all we've got is immunosuppressants, we've got prednisone, we've got methotrexate, which is low-dose chemo, we've got Humira. Humira is $10,000 a month that we're looking at. That's why you see it on TV on these commercials, because they're making a fortune off this drug. Every injection, $10,000, $10,000, $10,000. That's $120,000 a year, even before you've got doctor's appointments and any other medications, anything else that's going on there. So instead of fixing the why, this is the problem with traditional medicine and chronic conditions, is they don't get to the why. They're getting to the symptom, and then we try to change the symptom, but we don't fix the why. They say, oh, the immune system's attacking itself, so suppress the immune system. Well, guess what? That does nothing to change the outcome. You go off the immunosuppressant, you're right back. Versus if you get to the underlying whys, you can calm down that autoimmune reaction and you can keep it at bay for as long as you do what you need to do. Hey, Courtney, great to have you on. Good to see you there. So here we go. 3 top causes of autoimmune. Number 1, and this is really interesting. So women have an 8-to-1 ratio of autoimmune compared to men. So there's eight women for every 1 man that has an autoimmune condition. I know it's not fair, it's not right, but it is. And this is one of the main reasons why that is a issue, is that estrogenic events are happening in women all the time. In men, yes, some men can convert their testosterone, they start getting man boobs, all those things, but for the most part, guys are not having estrogenic events, but you women out there are having estrogenic events every stage of your life. It's not fair, but it's true. Last year, we found 3 teenage girls with Hashimoto's in 1 month. What was that? Well, that's Hashimoto's, autoimmune to the thyroid, and they went through puberty and it triggered this. How many of you women out there, give me a thumbs up, how many of you women out there never were the same after one of your kids? So it could have been any different thing. It could have been your first kid, second kid, third kid. You could have had more fatigue, brain fog, your guts aren't right, a lot of different things. But a lot of women are never the same. Here comes some thumbs coming up there. A lot of women are never the same after one of their kids, and it's usually that estrogenic event. And if I hear that, the first thing I think is, oh, you know what? It's probably autoimmune. Let's dig deeper and see what's going on in there. So yep, and so Courtney Hashimoto's after losing a child, same thing, estrogenic event, going on birth control, going through menopause, going through hormone replacement therapy, all these different things that women get hit with over and over and over, but that estrogenic event can drive that immune system to start attacking its own tissue. So, and Courtney, the same thing, it could even be that stress of that situation as well. Adrenals are one of those things also, not talking about that much today, but stressful events can drive that. So you have that estrogenic event and the major stressor all at the same time. So estrogenic events, you've got to make sure that your liver is processing out the hormones as well as possible, that your estrogens are not too high, you're not going on hormone replacement, which is basically what birth control is as well. Is birth control is going to be hormone replacement. It's not suppression. You're actually adding hormones in, so it's throwing those balances off there. So estrogenic events, huge part of this. Number 2 is what we call leaky gut. Leaky gut is in that small intestine. Small intestine is where we're absorbing all of our nutrients into the bloodstream, and leaky gut is going to be where there's damage to these little finger-like projections that are helping to absorb nutrients into the bloodstream. Leaky gut is going to allow bigger things into that bloodstream instead of it keeping it out. So what does that do? Well, instead of this being little small broken down whatever it is, bigger particles come in and are going to create this bigger response, and it's going to be this exaggerated response. I always say, instead of shooting that little, don't worry, all those PETA people out there, instead of shooting that little squirrel with a BB gun, you're going to get out the bazooka and you're going to go boom, and you're like, holy cow, what was that? Was that like a tank or something? Like, no, it was a squirrel. And you're like, we didn't need to use the bazooka, we could have used the BB gun. But what was going on was this over-exaggerated response, and that's what happens in our intestinal lining, and it's going to get that stuff into the bloodstream too early. It could be food. We know gluten is a huge part of this. Dairy, corn, soy, different foods are going to cause this. We did a post today about the autism and the rates that we're seeing, and that's a huge part of it is leaky gut, and even autoimmunity in the mom is going to contribute to the kid's autism. So leaky gut is going to be the foods getting in, pathogens, bad bacteria, different things getting into that bloodstream too early and creating this reaction. Why does leaky gut get there in the first place? Well, that can be from pathogens. If somebody does have parasites or bad bacteria, yeast, candida, anything like that. It can be from taking antibiotics, even way back as a little kid. If you've been on more than 2 or 3 rounds of antibiotics, your gut will never be the same. That doesn't mean we don't try and we don't give probiotics and kill off and do all these different things, but it will never be like a native gut should be. So that leaky gut We know that we've got this this damage coming in, chronic stress, just like Courtney was saying she had, and you know that is a huge part of this. So Courtney had a question there, so that's why I have two spectrum boys, autoimmune issues. Unfortunately, and I never say things to guilt moms, but unfortunately, a lot of autistic or spectrum kids, it's because of mom having blood sugar, autoimmune, inflammatory, all these issues, and during that pregnancy, that stimulates this inflammation in the kid's brain and primes them for this damage. So estrogenic event, leaky gut, we've got to heal up that leaky gut, and then blood sugar swings. We always say every time that blood sugar goes up too high or down too low, it's going to rev up that immune response and it's going to destroy more tissue. So what do we have to do? This is why we've used glucose monitoring for years. We've got to get that blood sugar as steady as possible and stop the swings, stop the highs and lows that are going all the time in the body. Every time it spikes up, we get this insulin response, and that's going to stimulate that immune system. Every time it crashes down, we get this adrenal response, and that's going to stimulate that immune system. So estrogenic events, leaky gut, blood sugar swings, top 3 reasons why people are having autoimmune conditions. So what do you need to do about it? Well, one, obviously, exactly, Christy, don't blame yourself. Courtney, do not blame yourself, but that's something that we see all the time. And now, you've got to go back and you've got to say, okay, what can we do to calm down this immune inflammatory response in there as well? So the top things, vitamin D, you want to get your vitamin D to about 80. People ask how much. I go, I don't know. You got to test it and see what happens. Some people say, I take vitamin D, I can't get up that high, or I take vitamin D, I get nauseous. Look into a tanning bed. Even once a week is not going to cause skin cancer. And tanning beds, we see vitamin D get up into that good range all the time, especially from here moving forward. If you live north of Oklahoma, you're not going to be getting enough sun to be able to keep your vitamin D levels up, even if you're getting outside. So you've got to get that vitamin D that modulates the immune response. You've got to stabilize the blood sugar, keep it between 85 and 110 all day long. Any of my patients jumping on out there, they know what this looks like and feels like, and they know it's possible. Even diabetic patients, it's possible. 85 to 110 all day long. So vitamin D at 80, keep that blood sugar as steady as possible. Work on that leaky gut. You've got to kill off, you've got to rebuild with good bacteria. And one of the basic things that you can start doing, and we'll post a link down below, is glutamine. So L-glutamine is one of the most basic things. Even for kids, it's okay. It's a really great healing amino acid, and that is going to be a big part of healing up that gut lining. So those are some basic things that you guys can get started on right now to get that autoimmunity calmed down. So vitamin D, you want to stabilize that blood sugar, work on the leaky gut, and even the glutamine would be a great place to go. So love having you guys on. Autoimmune, it's crazy, it's rampant, it's hit my family hard. My wife lost her spleen, my mom was in a wheelchair, my wife also had autoimmune to the brain, which affected her on a lot of levels. So it's rampant, and if somebody just lets their body go haywire and doesn't pay attention to things, and they've got the right genetics, absolutely 100% autoimmune is coming their way. So pop down any questions you have below. Love having you guys on. Stay strong, keep the body cranking, and we'll go from there. Take care, guys.